Thanks for joining us on air and streaming on KARE 11+. I'm Lauren Lemanchek. Tonight, Minnesota's rural hospitals are facing a dire financial hurdle. And one says it's gotten so bad they could be closing in a matter of weeks. Jennifer Hoff has more on what's causing this. Jennifer?
Lauren, the CEO of Mille Lacs Health System says a technical issue with a new program that the Centers for Medicare and Medicaid Services is now using to process payments is holding up millions of dollars. Intended to prevent fraudulent billing, he says it's instead rejecting legitimate claims to hospitals. In Onamia, there are some 700 residents in the small town, but only one hospital.
This is patient accounts or the billing office.
Where Beverly Inslee was not only born, but has now worked for 3 decades, tasked with checking the status of Medicare claims.
One by one, line by line.
That since the new year, the federal agency has mostly rejected, withholding nearly $3 million in reimbursements to the Mille Lacs Health System alone.
Yeah, it's difficult.
The problem stemming from a payment processing change the Centers for Medicare and Medicaid Services implemented last summer, according to the hospital's CEO, Andy Knutson, calling it a technical issue with the software system now not enrolling its providers means bills can't get paid.
These are legitimate costs that we've been billing the same way for years, and now that Medicare is telling us that it's incorrect, even though we've been doing it the same way for 70 years. We can't get a good answer for why this is happening.
What's worse?
It's bad.
Without a fix, Knutson says the hospital could close in a matter of weeks.
We're at the nurses station, so they take care of all of our patients.
A place that employs more than 400 people.
Takes everyone.
And is 40 miles from the next closest hospital, called Critical Access for rural areas that rely on this billing method. Knutson says is likely impacting more than 100 of those kinds of hospitals across the state. And eventually, their patients.
We can't fail, right? We can't fail. I can't fail my employees. I can't fail the community. I can't fail my patients. So we're going to keep trying and try to get this fixed.
A burden everyone here is carrying.
It's huge.
One even Beverly Inslee says she didn't see coming.
This is much more than a job. This is my community. This is my family's welfare.
Now we know Knutson and senior leadership are taking a 10% pay cut, as well as looking to grants or even a bank loan in the meantime as some solution here. The Centers for Medicare and Medicaid Services did not respond to our questions, but did send a statement to our news partner, Minnesota Public Radio, saying, quote, "It remains committed to both protecting taxpayer dollars and ensuring that hospitals receive the payments they are owed." Knutson says if there is a fix, the hospital could very well get its money, Lauren, in as little as just 2 weeks. So he's certainly hopeful that that happens.
And so many people depend on that. You were telling me it's not just the hospital impacted.
Right. This is a system, right, for that area. So if the hospital does close, it could also mean that 5 smaller clinics in even smaller cities around that area would also close.
Vital to the community. Jennifer, thank you.
Yep.